Welcome everyone to Senior Living 101. Today we're going to be comparing in-home health versus in-home care. I'm going to be introducing Lois Jasmer from Brookdale Senior Living. Lois reached out to me to help set up this series, so I just want to say thank you to Lois. I think this is such a great opportunity. I'm very happy to have you here. Quickly to introduce myself, I am the Community Resource Navigator. My name is Katie Auger, and I work with both the Bainbridge Island Senior Community Center and also Island Volunteer Caregivers on Bainbridge Island, which is a nonprofit. I'm happy and available to speak with anyone. You can call the Senior Center if you ever are interested in learning about resources or would like any follow-up after today's session or any other sessions that we have. Okay, I'm going to turn it over to Lois. Thanks again, Lois, for being here, and I'll let you introduce our guests.
Great, you're very welcome. We're excited to be doing this with you, and it's going to be mostly an educational time for you to learn a little bit about the differences in several things throughout the series. So today, as she said, I have John Bright from Home Helpers, and I have Mary Webster, and she is with Kindred at Home, which is home health. So what we're going to do today is I'm going to start out with John and have him tell you a little bit about what in-home care is. I have a few questions for him that if he doesn't cover them, I will be asking. And like I said, feel free to throw in the chat box your questions, or we will save some time at the end to answer questions as well. And then I will have Mary Webster talk a little bit about home health and what that looks like. We'll kind of compare the two because this is an area that a lot of people, I think, get confused on. So, John, I'm going to let you go ahead and get started there.
All right, thank you. My name is John Bright, one of the owners of Home Helpers Home Care. We're out here at Paulsbo. We've been doing this close to 6 years. We have myself, my wife Jessica, she's one of the other owners, and Shauna, which she's our director. So she came on as an employee, and then we loved her so much, she's super amazing, and so we made her a part owner, which is just wonderful. So I'm gonna kind of give you kind of a brief idea of what we do and how we differ. So in-home care, so we call it in-home non-medical care, right? Or private duty. That's one of the other words that can be used. If you see that anywhere in like legislation or somebody talking about it on TV, they might call it private duty. The reason why that is because we're coming into your home. So some seniors want to stay in their home until the end. Some people want to be like at a facility. They want to have other people around, and that's what they want. So it's really just like your preference. Either way is actually great. There's amazing, like the ones here on Bainbridge are amazing facilities. I've walked through them before and had tours and stuff. But some people just don't want to leave their home. You know, I've been there for a long time, and or maybe like we have clients that built their own home and they just want to stay, and so they would get a hold of one of our kind of companies. So we come out, we assess the need, we try to what we want to do is make sure that we're the proper kind of service. So sometimes the desire to stay home is beyond our capabilities, and so you may have to go into a facility of some sort because of that, because we have what we call home care aides. So they're almost like CNAs. They pretty much go through some of the same training, except for that their training is pinpointed towards a private home instead of like, say, a hospital or a facility. So they do pretty much all the things that you need to do, the activities of daily living, right? So having, getting up from bed, getting dressed. If you need help, like going to the bathroom, you need reminding for medication. You need somebody to go help with shopping, get to appointments, remind about bills, Sometimes those are some of the things that get missed, especially with like bills. So remind you of those kind of things. Even like little tiny things like remind you of somebody's birthday's coming up. And we can do those things and remind you. But the other really important thing is that their companionship, right? So they can be right there with you. They're also really, it's also really flexible, right? So when you're at home, you can be there, you can have somebody there for like a few hours or up to 24/7. So we have a variety of different kinds of clients. We also partner with home health. So when she talks about a little bit of home health, there's a different aspect of that, okay, that they do, and they can either work with us or they can work separately by themselves, or we can work by ourselves too, but we can also work together as a team. And I just got to kind of point out, probably bad, I don't know, we love Kindred. Like all the girls love Kindred. Like they're just absolutely the best all the time. They're just amazing. But usually with in-home care, so it's not usually covered by Medicare. Okay, so it's usually private pay. If you have long-term care insurance, that might help pay for it. There's also VA benefits called aid in attendance that you can use if you qualify. And then the state also has something called the COPES program, COPES, and that's for people with low income that can't afford our services. So with cost per hour, if you think about it per hour, especially when you're paying private pay, it can get a little bit expensive, right? So so you have to kind of weigh those options. As of right now, in-home care, the cost we did an analysis before this. So what we're seeing around this area is between $32 to $41 an hour. That's what they charge. So, but if you just need like certain help, right? You only need it for 4 or 5 hours, like maybe 3 times a week, right? That might be the cheaper option, especially if you want to stay in your home. If you end up needing more care, what could happen is that the cost can get up there. And so up to 24/7 care, what we've been seeing, I think the highest we've been seeing, I think is about $24,000 a month. And that's where it gets to. Mm-hmm. Okay. So there's some places that will be quite a bit cheaper. I've seen like as low as like $8,000 or $10,000 a month. I would personally stay away from those. There's a lot of regulation, which is good, and we welcome that. But we also got to pay the caregivers properly. We got to pay taxes. We got to do all those kind of things, just like a business does. And so you get what you pay for. Okay. We're insured and bonded. That is really important for because in in-home care, there's a lot of fraud. There's a lot of like independent people and stuff that maybe not be registered with the state at all, or could be registered with the state that don't work under a company, and therefore they don't have the proper insurance to cover. We just like the facilities, just like in home health, we constantly do ongoing training for our caregivers. And if we have to do custom training, because sometimes what happens is that the facility can't take them because there might be like some, like we have a couple clients where they can't be in a facility because the type of care is so pinpoint and so precise that we're the ones that have to do it because it's that custom. And so that might be one of the reasons why you would need it. We have with us, with the non-medical care, we also have fall detection devices. We have wellness calls. We have meal plans from like a third party kind of thing. And so if you want that whole immersive experience, you can have that. I'm trying to think of all the other things. There's so many different things that we've learned in all these years.
I want to go back, John. I want to go back to the licensed and bonded piece. I know a lot of seniors will try to maybe save a buck here and there, and they'll go on Craigslist or they'll hire somebody they know from church. And that's always, that can be kind of a problem, because if anything goes wrong, if they get hurt, you don't necessarily know. And like you said, there are a lot of scams out there. So I would really recommend, if it's, some licensed bonded in-home care, is going to be safer for you and for the other person both. So
yes. So yeah, on that. So if you get somebody that's unlicensed and not bonded, and they enter your home and they get hurt, they can come after you legally. Mm-hmm. So Washington State, they can do that. So you're on the hook for it. Okay. What we see is that when people like they decide they want to go on Craigslist instead because they want to save that money. A lot of times what happens is they call us back because a lot of times, unfortunately, it just breaks my heart when I hear it. There's a lot of theft, fraud that happens, and once you catch them, they poof, they're gone like magicians. They just kind of disappear. One of the worst ones I've heard was stealing of cash. It was $70,000 that they took before the senior knew anything at all. Mm-hmm. I'm sure there's worse ones, but that's what happens. Yeah, and there's a lot. There's a lot of it. There's a lot. There's so much so that I'm a member of the Home Care Association of America, and so I've volunteered to go down to Olympia when we're able to again, and go to Washington D.C. and help kind of lobby to see if like there's ways that we can help with with costs and stuff. This is why this stuff is coming up, because we're constantly trying to help with this, because it's a huge need. Seniors need help. I firmly believe that seniors have helped build this country, and we are in debt to you for forever. You're amazing, and you should be treated with dignity and respect, just as anybody else, right? And you shouldn't be cast aside. You shouldn't just I'm just gonna go whatever. I'm not gonna, I won't take care of that person, whatever. None of that kind of. I really believe that. But we need.
So John, I'm going to switch over to Mary here because we're about halfway through our time.
Lois,
I was right. Yeah, I'll keep on talking. California thing in me.
Sorry. And if we could, we did have one question come in. If we could just take a quick moment for John to respond. So you mentioned certain conditions that would not qualify for someone to receive in-home care. Could you quickly kind of give a description of what some of those things might be?
So sometimes people need like a 2-person assist, and the downside to in-home care is that if you need 2-person assist, you can have 2 caregivers there, but you're paying double, right? So you're paying, so one of the nice things is, say there's a couple, you have that one caregiver, we only charge for the caregiver that's there. So then you get kind of, then you get help 2 people for the price of 1 kind of thing. Sure. But if it's the other way around, you're paying double, right? So if it's $41 an hour for that one caregiver for, let's say, Seattle or so, well, now you're paying $82 an hour for 2 caregivers to be there, right? Way too expensive. So you would want to find a facility, and it's going to be much, much cheaper, and they'll be able to help you with that. And so that's a huge downside to that.
Also, anything nursing wise, like shots or wrapping, like wound care, anything that a nurse should be doing. And maybe Mary can hit a little bit on that. So we're going to switch over, and then when she's done, we'll go back to the questions again.
Hello, everybody. Hi there. Thank you for inviting me. It's truly an honor. I love working in this community. I've been with Kindred almost 14 years and lived in Kitsap County 35. Kindred pretty much is the same as Home Helpers, except we do operate on a little bit of different, more stricter lines. We have guidelines based by Medicare. Ours are based on the need of the patient, orders from the doctor. So we have specific guidelines that we have to adhere. So as an example, if you were to go see your doctor and you were feeling that you needed some extra help with your balance and so forth, the doctor would send us an order. We would verify everything with you, the patient, come out and see you in your home and provide that service. And that is covered 100% by Medicare. That is the difference. We come to your home, we come to your home as well, but we are governed by our strict guidelines of Medicare order, need, homebound status, quite a few different things. We here in Kitsap County, and thank you, John, for that, because our staff appreciate your staff as well. It's been a really great partnership because we can help we do help each other all the time. Most of the doctors here and folks don't feel bad because a lot of our doctors, we've had to educate them too on the difference between home health and home care. And they have thoroughly appreciated, because the main purpose of home health is to keep everybody safe in their home for as long as they can. And safe is where we want them to be. So when we take a patient on for service, Medicare says we can have 60 days to see you, and we build a plan of care. In that plan of care, you can have a nurse coming to your home, you can have a physical therapist coming to your home, you can have an occupational therapist coming, as well as a social worker. So you get quite a few options to help you in your home. In that 60-day period, if you haven't met the goals that either the nurse or the therapist have for you, we just call the doctor and let them know that you're close, but you haven't progressed enough. We'd like to work with you again. The doctor gives us another order and it is covered by Medicare.
Mary, can folks, can they privately pay for home health at all, or no?
Not through us, because we are certified by the state. We used to, many years ago, we could do private pay, but we cannot do it. We had that part of our certificate taken away. We do also contract with some other insurance companies. So there's, as everybody knows, there's 1,000,001 different policies out there in the world. So we always like to run everybody to give them the benefit of the doubt, because even though you may have United Healthcare as an example, which we don't take, there are now United Healthcare Optimum plans that we do take. So we like to run that as well. And the whole part of this is our community is that, you know, we do want those folks to stay home as long as they can, to reserve those dollars, that so when they are ready to, or need to move into some place like Montclair, they're doing that when they're ready to, not because they have to. We do wound care. We do catheters. We don't do any like PICC lines or anything like that. We don't have our nurses aren't up to that stuff. That's a lot different certification. And as John said, our nurses too are licensed. They do their training and they have to do their continuing ed every year. I will say Kindred is in itself its own surveyor. We do our own internal surveys, which are usually twice as hard as Medicare, because we want to make sure we're the best of the best, both in the field and in the office. But we are considered also intermittent care, because when a nurse comes out, she's not there for 3 or 4 hours. She's there usually for an hour to provide the service that's needed and then leave. They may come in 2 or 3 times a week, but they're not in there for extended hours at a time. So that's what's intermittent versus what John has. And I'll give you all a personal note here. As an example, my father has been on Kindred Home Health since August. He's in a wheelchair. He is still showing progression, so he's still on there today, but he also has private home helpers or home care, because he lives in a different county, hired, but they only come in 4 hours a week. So he gets the best of both worlds, and they work together. So it's a great relationship.
Right. So you can also, both of you, even if somebody does move to a senior living setting, both of you are allowed to come in and do your pieces, even in a senior living setting, whether it's an independent living, assisted living, whatever, correct?
Yeah, we do for home health for our part. A lot of times if it's a really basic medication management, we leave that to the assisted living because they have nursing oversight. And so then we will come in and do the PT part, OT part. If there's a wound that needs to be addressed, we can do that as well, as far as the dressing changes, and work with them there, because a lot of times that's a little more above their scope at the facilities.
Can you just really like a short answer to each of these, but can you tell me just a little bit what the difference is between OT and PT that might come in? Like what would OT do maybe that PT doesn't?
So OT helps with a lot of the daily activities. And also when they come into the home, they also look at the bathroom for safety, where bars could be placed so that as we progress with that individual, they can transfer safely into the shower, help with dressing. Maybe if they have to reorganize their kitchen a little bit so they're not reaching so hard to cause them to fall off balance. So it's all about that, more of that safety.
Does, can someone, like, let's say somebody here has a family member that's got some dementia going, can a doctor order OT to go in and do an evaluation or a cognitive eval on somebody through home health?
We do that, but we do that with our speech therapy. The speech therapist is the one that does the cognition. And then if she feels, and always too, when we do have somebody that has dementia, we always do call the family to get permission to come in and eval and treat. So that they're aware that we're coming. But yes, our speech therapist does do that.
Okay. You answered a lot of my questions here. It's great. So basically with one of the big differences between the two of you would be that with home health, you have to go through basically a doctor to get that service. With in-home care, with John's type situation, they can call up and set that up on their own.
Yeah.
Is that correct?
The one thing that everybody has to remember too is per Medicare right now, if your resident wants to have home health come in, they have to see their doctor for that reason 90 days prior to us coming in. That's what they call a face-to-face visit. And now with COVID, it can be a Zoom, but it has to be a Zoom with audio. And it has to be documented in the chart because that's as close to face-to-face as they can. And that's one of the big sticklers that Medicare is saying they want you to get that done before we can come in.
Okay.
I would like to let you know, I do have my coworker, Brooke, who handles the hospital. She happened to pop in today and wanted to hear that she's done a couple of these as well. So we appreciate it.
Yeah. Hi, everyone. Thanks for letting me join. It's been wonderful.
Great. So, a question maybe for both of you would be, and I think I'm kind of maybe hearing it a little different here, would be if somebody wanted either of your services. Mary, it sounds like yours is going to be something that can't maybe happen immediately. John, I don't know on you, would it be something that could happen pretty quick or not?
So for us, because you don't have to go through a doctor, right? They could just call up right now. And so depending on the circumstances, we could start the same day.
Uh-huh.
But usually it takes about 7 days or so to get started. If there's any emergent issues, we deal with those. So if we feel like maybe they have to go to the hospital or physician or something like that, we push for that first because we can't deal with those kind of things. And then and if we see that there's home health, we encourage them to call, like say Kindred or call the doctor and get that kind of going. Yeah.
And we try our best to do 24 to 48 hours. Sometimes it's not the most optimum. However, I mean, right now at our agency alone in Kitsap County, we have over 325 patients.
Wow. Okay.
So we are diligently out there. And the one thing I will say is we've built a really great alliance also with CHI. And the whole thing is it's the care about the patient. That's the most important thing. So if we are not able to do them, we will move heaven and earth to get another home health company in there to service that patient.
Okay. So do any of our listeners, do any of you have any questions? Do you have any, Katie?
Yeah, well, and I'm happy to give folks a chance, and I'll just remind people that you are muted. So if you do want to, you can either type in the chat box, or if you want to go ahead and unmute yourself. I do have a quick question for John, so I'll jump in with that, but anyone else, feel free to unmute yourselves. John, I know you mentioned the COPES program, and again, for anyone who's joined a little late or is not familiar with, so the COPES is a Medicaid program that can offer financial assistance in covering the cost of in-home care, because otherwise this is generally an out-of-pocket cost. So John, if somebody is needing to sign up or is interested in exploring COPES, is that something that home care agencies can typically assist with, or are you able to refer folks on so that they can get some assistance if they do want to explore that as an option?
So the moment we refer on, there's only like a few agencies that will do it, and they have like their quotas on that too. So they're only going to keep around 10 or 15% that they can use. The reason why that is, and unfortunately, a lot of the agencies end up could lose money from that because they just don't pay enough, and so especially with caregiver costs and stuff going up. So yeah, so they can always call us. They can call. Well, actually, you know what? I'm gonna tell you. You can call pretty much any agency. So we're gonna kind of direct you the right way. I've called the other agencies. They're really great about it too. Like Comfort Keepers, Home Instead, Visiting Angels and stuff. They're really awesome about it too. So you just tell you just gotta be upfront with them, right? So you don't want to go through a whole consultation beforehand and then tell them later on, well, I don't have enough money for this, and because it's gonna be a little bit of a different kind of setup for that. So.
Hey, Katie, can I add to that?
Yes, please.
So at Kindred, we have a social worker, and most of our social workers that we have are well aware with the COPES programs. And so when we are in the home, even if it's not ordered in the beginning, but once our staff gets in there and feels that this patient can really get some help, we can initiate the application and help them fill it out. And then they have their contacts too down at Olympia to help them get that process going.
Good.
Perfect. Thank you for that, Mary. And I will say that when I asked the question, I, was a little like hidden about the fact that I will also say too, if folks are have questions about the COPES program or interested in learning more, there are social service agencies that can help answer those questions as well. So if you do need some additional guidance, or if maybe you're not quite at the point yet of getting in-home care, but you just would like to explore it, you can contact the Senior Center, and we can also help you get that information. So thank you both, Mary and John, for that response.
Well, and I just want to thank Mary and John for being on here today. If you do need to contact either one of them for any questions, you can reach out to Katie. Her number is 206-842-4441. You can reach out to me. I'm at 360-697-2223.
If you have any other questions for our guests, either contacting their agencies, or again, contact the Senior Center, and I'll be sure to get you in touch with any of the folks that joined us today.
Yeah, it was great. Thank you all for being on.
Thank you. Nice to meet you.
John and Mary. Thanks, Katie.
Thank you so much, everyone.
Yeah.